Now it's your turn to get free advice from the dentist. Dr. Mark Hyman is here to answer your questions about family and cosmetic dentistry too. If you have a question for him, our phone lines are open, 1-800-807-8255. And this month we are celebrating Children's Dental Health Month.
Cindy, it's Children's Dental Health Month and we're excited for that. Things that we're talking about to folks is for a power toothbrush like the Sonicare from Philips.
Those are great.
They're wonderful for kids of all ages. Anyone with braces, absolutely. These are great for the little people. New study's been done that a lot of consumers thought that kids weren't supposed to have fluoride till they were 2 years old. What we now know, as soon as the kids are born, as soon as teeth come in, we want some fluoride, a small amount wiped over their teeth. So using a fluoridated toothpaste like a Crest is a great opportunity for that. And when you're at your dentist as well, we want people to have fluoride, absolutely.
Definitely.
Kids and adults.
All right, let's go to the phone lines because we have Michael on the line with a question for you. Good morning, Michael.
Hi.
How are you?
Good morning. Good morning.
Good morning. What's your question?
Yeah, I have a wisdom tooth that was filled in probably about 6 months ago, and it slowly started deteriorating around it, but the filling is still there, and it's just causing massive pain all over the right side of my mouth, and I don't know what to do about it.
Michael, I'm sorry you're having that pain on the wisdom tooth. It's really rare that anybody has room in their mouth to keep their wisdom teeth long term. So my thought is to go see your dentist and talk to him or her about what's appropriate about getting it out. Most folks will ask me, well, should you do one at a time or get all four done? To me, if you're going to go through it, do it once, perhaps pick a Friday where you can hang out for the weekend and just get it taken out. Again, most people don't brush back at the wisdom teeth. They can't floss back there. So I'm glad you tried to keep the tooth by getting it filled, but it sounds like it's showtime.
Let's go to Donna in Moxville. Good morning, Donna.
Good morning.
Hi, Don.
I have a question. I had a procedure done back in January. It's called a scaling.
Yes.
And I had an 8+ to 9+ bone loss in the back tooth.
Right.
And, okay, I'm sorry. Let me put this on me. And the procedure, I think it damaged the nerve. They wound up having to take the tooth out. And now I still have numbness in the left lower quadrant of my mouth. Like I just left the dentist's office. It seems like it's becoming more localized. But is that going to heal in time? All those teeth that shifted down there and the nerve?
Right, Donna, I sure hate that that happened to you. I'll tell you, when you have a lower wisdom tooth taken out, there's a chance that the nerve can get bumped and that you can have some numbness in the tongue or the lip or the cheek that can last a day, a week, a month, a year. Very, very, very rarely it is a permanent change. Usually it is just change, again, in the sensation, not in the motor, so you can still smile and sing and kiss. And I would go talk to your dentist and discuss the symptoms with them. If it persists, there is a procedure that can try to do a surgical procedure to try to regain the nerve. But I'm almost sure that time will heal it. So again, I'm sorry that you had to go through that, and I'm glad you're getting a little bit better.
Let's go to Linda in High Point. Good morning, Linda.
Good morning.
Hi, Linda.
What's your question?
Several months ago, I fell hard on a hard surface, and at the time, I had stitches in my chin, which had a big gash in it. Other than that, I didn't have anything done, but I've noticed that my whole bite seems to be off, as if my jawbone had moved, because my teeth are not coming together as they used to do.
Right.
And I've been to the dentist 3 times about it. They took sawed off or whatever, the part of my teeth so they wouldn't hit so hard, but it still continues to bother me, and I don't know whether to go back and have the teeth cut down again, or if there's something that can be done to my jawbone.
Right. Linda, again, what a terrible accident. When that happens, what the jaw joint's called the TMJ, the temporomandibular joint, and it sounds like you had a hit to your chin that really traumatized your jaw joint. doesn't sound like you broke a bone. It just sounds like that the disc, the piece of cartilage that's between the bones up there, really got mushed, and that's kept your teeth apart. So I would discuss with your dentist, see where you are now. Over time, things could happen, like having a bite guard to help protect you, having orthodontics, having injections in the jaw joint. There's even a surgical procedure, and that's really tough. And I wish you well. I hope you go see your dentist and talk to them and see where you've progressed, celebrate the good part, and see what we can do differently.
All right. Thanks so much for coming in.
Nice to be back,
Good to
Cindy.
see
Thank
you.
you.